Hey guys, in this video I'm going to introduce you to a female pelvis model. We're going to start with the external genitalia and then work our way into the pelvis. Okay, so this is the anterior perspective. Okay. The outermost genital structure is called the labia majora. The inner pair of labia or lips are called the labia minora, and they are immediately surrounding a few structures. Most anterior is the clitoris, or the glans clitoris. Moving posteriorly, there is the external urethral orifice, so where the urine exits the body. And behind that, posterior to that, is the vaginal orifice. Okay, so let's move inside. All right, just some basic orientation here. All the way posterior are the digestive structures, then reproductive, and then most anterior are urinary structures. Okay, before we even take this model apart, I want to point out the sigmoid colon going into the rectum, the ovary, which is the gonad of the female, fimbriae, little finger-like projections around the ovary, and the uterine tube connecting to the uterus. Okay, the urinary bladder would be way over here. Note that the uterus is anteverted. It is actually pointing forward, kind of laying over top of the urinary bladder, which of course we can see a lot better on the inside. Okay. Once again, posterior to anterior, digestive, reproductive, urinary. All the way anterior, there is a fatty patch right over the pubic symphysis. This is called the mons pubis and is protective of the pelvis, which is deep to it. Okay. Here is the clitoris, an erectile body and homologous with the male penis. This down here is the glans clitoris. Okay. External urethral orifice. Urethra, so the tube that allows urine to exit the body. And this here is therefore the urinary bladder. Note that the urinary bladder, like every other organ and tube throughout the body, has 1, 2, and 3 layers. The layer that we care about is this one right here, which is a muscular layer called the detrusor muscle. Okay. What is not evident in this model is a circular muscle, which would be right here, kind of wrapping around the top of the urethra. This would be called the internal urethral sphincter, and is responsible for controlling the flow of urine subconsciously. What is obvious on this model is this urethral sphincter right here. Note that this is a circular muscle kind of coming out of the model towards us, but it has been cut. And so we're just seeing the two halves. It's kind of like a C around this right now. And this is called the external urethral sphincter, and it is embedded within the pelvic floor. So this muscle layer right here. Okay. Moving back, this is the vaginal canal, birth canal, or vagina. At the most superior portion of this tube is the cervix. Cervix is the opening into the uterus. And so again, like every organ and tube that we've looked at this term, the uterus has 1, 2, and 3 layers. The outermost layer is called the perimetrium. Next is the myometrium, and so this is a really thick muscular layer, which is very important in both shedding of the endometrial lining during a menstrual cycle as well as childbirth. Okay, so that's where the cramping comes from, right? Contraction of this guy. All right, so perimetrium, myometrium, and this innermost layer, which is pink with the little lines on it, that is called the endometrium. And so that is the layer that is shed, or at least partially shed, every month during a menstrual cycle, and it is the layer into which a fertilized egg is going to embed. And so if there was a fertilization event over here in the uterine tube, that fertilized egg is going to be moved down the uterine tube, formerly called the fallopian tube, into the uterus. And then it is going to implant into the endometrium. During the developmental process, this structure right here, which is called the placenta, is going to develop as well. What we can see if we look really closely is that there are these little finger-like projections. These fingers were formerly called the chorionic villi, and they are extensions off of some fetal tissue. Right? So baby's tissue forms these little fingers, and mom's blood actually kind of pools into this open cavity surrounding these little fingers, and this is where substances, materials are exchanged between mom and baby in the placenta. Okay, so mom's and baby's blood should never mix. It's just mom's blood is kind of bathing around these chorionic villi, and in the chorionic villi we have, little blood vessels. Okay, so extending from this fetal portion of the placenta is the umbilical cord. And so if we take a look at the other part of this model, okay, what we can see is the fetus. Right, here's the umbilical cord, which has been kind of cut off, and then here is the other part of the placenta. Again, the placenta is both maternal and fetal tissue. Okay. What we can also see here is that there is a sac in which the fetus is residing and developing. This sac is filled with fluid, and so when your water breaks, that fluid from this sac is what is ejected from the uterus. And so this sac is called the amniotic sac. Okay. So those are the urinary and reproductive structures. The final structures, the most posterior, are the digestive structures. And here, as I said before, this is the sigmoid colon, okay, which empties into the rectum. And the rectum is this straight up and down portion right here. Okay. Rectum, rectus means straight. Okay. Where this tube narrows down and forms almost like a funnel, that is the anal canal. And the hole itself is the anus. We can see that just like any other organ system, there are 1, 2, and 3 layers of the digestive system. Right here we have the mucosa associated with the submucosa, muscularis externa, and serosa out here. Okay. All the way towards the anus, there are additional muscles, right? So the inner lining right here, this is called the internal anal sphincter, and just like the internal urethral sphincter over here, this is going to control bowel movements subconsciously. Around the internal anal sphincter, right? So kind of coming out of the model towards us and going into the model, a nice circle around the anus itself. This is the external anal sphincter, and this is what allows us to control bowel movements consciously. So we can consciously decide it is convenient to have a bowel movement, just like over here, it is convenient to have to go urinate. Okay, so once again, this has been the female pelvis model. We have seen urinary, reproductive, and digestive system structures. Thank you so much for watching.